We're joined by Dr. Marty Makary, who is the professor at the Johns Hopkins Bloomberg School of Public Health. He's also the author of The Price We Pay: What Broke American Healthcare and How to Fix It. Doctor, thank you for joining us today.
Good to be with you.
Absolutely. How did America end up in such a place with highly and dramatically high healthcare costs?
Well, we've been fooled into thinking that the solution to our skyrocketing healthcare costs is a government solution. Really, government just talks about how to finance the broken healthcare system. We need to talk about how to fix the broken healthcare system. And that's going to mean we address pricing failures. Look, people want honest and fair prices. They're getting gouged. Price gouging now has become a common business model in healthcare. And we've got to address the appropriateness of care. That is what we do, and not just reward more, but reward quality in healthcare.
Now, when you combine public, private, and out-of-pocket spending, more than $10,000 spent per person per year. I believe we have a graphic that also shows this, and really how the U.S. spends more per capita than every other developed nation. And so when you think about this, how, while we dedicate so much public funds to healthcare, does that dollar not go as far as other countries?
3 years ago, healthcare in the United States became the largest industry. It is the biggest business in America. And a lot of the spending is going to things that have nothing to do with health. And what we've got to do is change the incentives and cut the waste. There's a lot of waste in healthcare. As a matter of fact, there's a lot of waste in even the practice of medicine, separate from the business of medicine. It's time we start talking about how we treat diabetes with cooking classes instead of just throwing insulin at people. We need to talk about treating back pain with ice and physical therapy more often than just surgery and opioids. And we've got to address school lunches, not just talk about bariatric surgery and gastric bypass. Food as medicine is something that we've not studied and we've not been talking about. And to be honest with you, as physicians, it takes time to get into these issues. Not just do we need the research and the funding, we need a business model that enables relationship-based care so we can spend time and get deep on these issues rather than simply medicating people.
I want to come back to something that you said earlier as well, in the government's role in this and believing that there should be less of a government role, or what should the adequate response look like from the government? Because we've seen over past administrations, whether the Obama administration, even in the Trump administration, there was a prioritization of transparency in healthcare costs, especially at the hospital level. And then even now during the Biden administration, we've seen what the administration has campaigned on and what their response may look like. But much of that still needs to work through Congress as well. And so with all of this in mind, what is the sweet spot for the government to be playing a role to have oversight of healthcare so that the citizens are not paying exorbitant costs?
Well, I think that we all want to see coverage expanded. We all want everybody to be able to have access to healthcare. Now, I'm sure there's some diabolical person out there that doesn't want that and wants people to suffer, but we all want to see access to healthcare and to see that universally. The question is, are we going to throw good money after bad into a system until it implodes, or are we going to cut the waste? We already spend enough money to give every person within our borders gold-plated healthcare if we could just cut the waste. The fundamental problem in healthcare is that we have non-competitive markets. And when you see a non-competitive market with price gouging and predatory billing, the temptation is to create rules and boundaries within those markets. But the fundamental change we need is to convert them to competitive markets. And we're seeing that through new price transparency, competition. We're seeing employers drive a lot of this. And we're seeing websites now where individuals can shop. I'm involved in one called Sesame Care. MD Save and others are creating a user interface now. Hospitals are now required by law to show honest prices, cash prices for common services. That's the change that we need right now, instead of just throwing good money after bad into healthcare.
What inspired you to write this book?
Look, it's embarrassing. People come to my hospital and say, how much is this surgery going to cost? And we don't have an answer for them. And when you talk to folks around the country about their frustrations with coming into healthcare and getting gouged, it is distorting the great public trust in the medical profession. And we as doctors and nurses should be offended by that. And there's a movement now to reclaim that. Hospitals, when they were built, were supposed to be a safe haven for the sick and injured, not a place for a business to take advantage of someone financially when they're vulnerable because of an illness. So we've got to reclaim things right now, and I think we're seeing a lot of movement in the right direction.
We've, on the price front, had a few cases where we've seen the alarming prices that those who have been able to survive COVID-19 yet have had to go to a hospital to make it through their own case. They come out of the hospital and have such high costs that they have to pay down. Some of them are going to be insurmountable. You have a new Alzheimer's drug that could cost $56,000 a year from Biogen. And as much as we need solutions, and there should be the research and development, there should be more solutions that comes out of the research and development. When you think about the pricing for them at the end of this, what goes through your mind? I mean, we can even think about the vaccine. The vaccine is paid for under Operation Warp Speed, and it has already had the purchase orders. But what about after all of those run out and everybody has been inoculated who desires to be inoculated? What then of the cost at that point?
Look, we have a lot of really disgusting pricing failures in medicine that we can fix and that are being fixed. You know, if airlines did not give you a price for a flight, and instead when you shopped for flights, it simply said the airline would bill you after the flight, guess what? There would be price gouging all over the market and a lot of distrust and dislike for that industry. But they have been able to build in the variation in risk and the variation in pricing into a predictable price. And that price is offered to consumers. That's what we can do in healthcare, and that's what we need to do. And with the drug abucanumab, which is a biologic agent, that is, it's an IV infusion, it did not really meet its endpoint in the trials. Many experts and the American Geriatric Society opposed the approval of it. It does decrease plaques in some early observations with Alzheimer's, but there's no evidence that it changes the symptoms. I think it's good to do more trials, but right now it looks like the joke is going to be on the taxpayers. $56,000 for a treatment, that's not something right now that can be justified, not at a time when we're rationing healthcare in other parts of the system.
As healthcare becomes more customized with the infusion of even more technological resources, whether that be via telehealth or whether that be in the digitization of so many experiences across the healthcare landscape, do you believe that that will finally cut down on some of at least the upfront costs that consumers do know about, most notably in their insurance policies? And then after that, how will it also dovetail into cutting down some of the other ancillary costs that are incurred along the way?
Well, I think the old days of coming into the hospital and navigating a big parking garage, checking in with security, sitting in a waiting room, and then seeing a doctor for 10 minutes for something that did not require an in-person exam, those days are gone and should be gone. We've got to move quicker and accelerate real innovation that's patient-centered in healthcare. So I think you're seeing a lot of good movement right now. And I think the biggest opportunity in America to save on healthcare costs is for employers to shop better on their healthcare benefits. Historically, they've done a really bad job and they've been getting ripped off. Most employers are getting ripped off on their healthcare through their benefit design. They can do better, and there are benefit advisors now guiding them appropriately.
Dr. Marty Makary, professor at the Johns Hopkins Bloomberg School of Public Health, thank you so much for joining us this morning. He's also the author of The Price We Pay, What Broke the American Healthcare System and How to Fix It.